we have surgeons coming to us and say, I feel sad. I'm going to save someone's life, but I know I won't make much money besides my professional fee. So that was the issue. It's pretty bad. So in the past, people say there's like 10 billion or more fraud in healthcare. It was really hard to spot because it was all done in paper. It was all like human. But future, if an AI can go over and figure out all the gaps that has existed in the system, the fraud will be pretty easy to find. The mistakes most people make is they try to do too many things, sell to too many different people. That's probably the biggest mistake anyone can make, because if you just focus on one hypothesis, a very specific one, and spend 2 weeks testing it out, you can learn a lot more.
And hello everyone, welcome back to another episode. Today I have a special guest with me, Charlene. Welcome to the show.
Thanks for having me, Ruben.
Oh, thank you so much for being here. You have amazing background. We're going to talk about it, and you guys are doing great at Ember. But can you give us like one-liner who you are and what are you building and what is the problem that you're trying to solve?
I'm Charlene, CEO of Ember. We are building a revenue integrity platform. What that meant is in hospitals, collecting money for the service delivered is not a straightforward process. You would imagine, patients see the doctor, service delivered, they have the procedure, and then doctors get paid. Realistically, that process takes around 30 to 90 days, and sometimes even longer, like forever, when the money never comes back. So that's the problem we are solving for health systems. There are a myriad of things we can talk about, but that's really the North Star.
Gotcha. And are you focused like on all hospitals or a specific type of hospitals or and
So
why?
there is a couple. We like specialized for-profit hospitals because
Hmm.
they have higher mandates on the cash flow. So it's really aligned, right? There's a lot of academic health systems that have like been in touch with us, but that's not our main priority because they have like researcher testing things out. That's pretty much taken care of. We like to serve people with high volume and high need.
Gotcha. Also, part of your product is ambient listening.
A
Is that
very
right?
early part, yes.
Can you tell me what does that mean and how would that help me as like a healthcare executive listening to this episode and how would that help me as a CFO of a hospital and help my physicians?
We really see ambient listening as table stake, whether it's using us, Microsoft, any hundred thousands vendors out there, doesn't really matter.
Yeah.
We just want to make sure the clinical conversation, the unstructured patient intake, all the things were captured. So
Hmm.
when you are building things, you are building that accurately, right? We have seen a lot of complaints for both under and over coding. Undercoding in the sense that it was clearly a complex system, a complex visit, but the quality wasn't reflected in the coding for both HCC, DRG for inpatient. We also have seen people complaining that it's not really a moderate visit, and doctor has nothing to really argue back, right? There is some fraud and abuse that we hear from the patient NPS complaint. So it's really to protect the integrity on both sides. The reason why we started and we had that is because it's a front door. And a lot of
Hmm.
folks at the point when we started 4 years ago, most EHR don't have an integrated scribe. And most people are still doing that with offshore human or some math students. So that was the lay of the land, but time has changed a lot since then.
Gotcha. Okay, let's simplify it even further. I am a CFO of a hospital and I really like what you're talking about. Talk to me through what are the steps of implementing the product and coming and talking to you and after the demo, how does it look like? Is it something on top of my EMR? Is it another tab I have to open? Is it something in the background that the physicians don't see or the user don't see? Let's talk through those steps.
Yeah, so our main product today is the revenue integrity platform, not the scribe, right? So to be very specific, we deliver hard ROI, meaning cash, whether
Mhm.
it's reducing your denial rate from 10% to 2%, which can account for 100 million, sometimes even more. The central layer is data. A lot of health systems have their financial data and clinical data separated. Even though
Mhm.
they're on Epic or Oracle or Meditech, whatever, it's really hard to know what's going on. So our first step is integrating with that data layer. Sometimes it's a database they host in the cloud, sometimes it's on-prem, sometimes it's like a backup. Either way, we have done that and we can just integrate with the right source to figure out what's going on. So number one, we provide analytics. What is the top revenue or loss driver?
Mm-hmm.
And then we talk about solution. Solution
Mm-hmm.
can come from a lot of things, right? The second step we do is auditing what has been going on for the past 6 months, a year, so you know how severe this problem has been. Like a health system we recently talked to said, oh, we had a terrible issue with elective surgery 3 years ago. We fixed that. Now our next problem is around emergency visits. We have no idea like what's going on. Patients there sitting for days, and then ER visit was delayed, right? So each health system probably has some shape or form of their top priority. Once we audit and find the root cause, we solve it. The solution can come from, better coding, charge capture, denial appeal, going after the dollars that were lost in transition, like a lot of different solutions. But really, it's about what's the specific problem that is causing most of their pain today and how to solve it in the most elegant way possible.
I really agree with you. I always tell startups that I work with too, like I think anything to sell in healthcare, you have to fulfill one of the two golden rules. Those are my golden rules. Either you save life or save money. And I think you're fulfilling the second one. And it's a big thing. Like people underestimate how tight the margins are for a hospital. I think the biggest money makers maybe are pharma companies because like selling drugs, especially like if they have a patent on it. But like hospitals really struggle with making money, and I think you're fulfilling that second criteria of like you're saving money for the hospital. I um, I read somewhere that one of your users, early adopters, have generated like over 60,000 per
Mm-hmm.
month in like more. Can you expand on that point?
Yeah, so 4 years ago, we started in orthopedics,
Oh, okay.
one of the most profitable slash volume center in probably
Yeah.
most places. The challenge is a lot of orthopedic surgeons, if they may operate out of ED, they may have their own private practice. It's really hard to collect out of network bill. If you have
Really?
if you have ever come across folks who are recently like called into ED, they may not be credentialized correctly. Like the process is very opaque. Sometimes they just
Ah,
write lost. So that's like $8,000 surgery bill not being collected every time. And to the
wow.
point, we have surgeons coming to us and say, I feel sad. I'm going to save someone's life, but I know I won't make much money besides my professional fee. So that was the issue. It's pretty bad to a point that we have a lot of folks in New Jersey, like they just have lawyers do that. Um, they get a job done, they take 20 to 30%, and it may take you 6 months to sometimes 2 years to see the cash coming back to you. So that was the reality that we went into. And just by picking out one category and solving it, like we can save them, or not even save, bring them the money they deserve to have in the first place.
Gotcha. And is that, I want to dig deeper more into the product. So when you are saving money for or getting more revenue, is it like, are we scanning the notes and bringing them together with coding bills, or are we notifying the physician that there is something missing? How does it work?
So there's many different. I can show a quick example.
Oh
Since
yeah, I would love that.
okay, this is a probably across 5 states.
Hmm.
Many surgeons, we will literally show them what's the accuracy, what's the coding accuracy per documentation. There's
Oh
audit
wow.
trail as well. So I think the most important thing is doctors are smart. They just don't spend all the time looking at the financial rules.
They
So what
they
we
don't spend
provide,
any time looking at the financial rules. Let's do
yeah,
it that way.
and it's not worth their time, to be honest. Like
Yeah.
these can be automated, the payer change their policy. So what we do is we constantly look at what is the latest thing, sometimes quarterly, oftentimes monthly. And then like if there is off notes, which affect a lot more than office visit, we will let them know what's the best way to code it, right? But honestly, coding doesn't account for more than 15 to 20% of denials. So this is
Hmm.
just a small percentage.
Yeah.
Oftentimes it's something with eligibility, with
Hmm.
the payers. And as I mentioned, like, is this in or out network and how do you deal with that?
And Ember can help with that too, right?
Yeah. So the way we do it is like eligibility information, like we basically have API connection to Clearinghouse to just check what's the latest, what's the secondary, primary, secondary, tertiary benefits, we coordinate it for them.
Mm-hmm.
We also have like AI agents that do phone calls to payers, so we can figure out
Oh,
like,
wow.
okay, what is the complex case here? We have seen people's EHR, they have their managed service. The people have been calling with conflicting opinions over the course of 3 months. So
Ah,
really drilling into the root cause and forcing a decision instead of just having payer give you an excuse. That's something we focus on a lot too.
that's pretty neat.
Yeah.
And can I ask you, so how did you end up here? Like, I think you had backgrounds, I think you worked at Google Health, and why and how you are trying to solve this problem?
There's a long story, but I'll give you a
Ah, I would love
medium
to hear
size
it. Tell me.
one. So growing up, both of my parents are physician,
Mm-hmm.
cardiologists, and ophthalmologists. I
Mm-hmm.
see one doing procedurals, one doing surgeries, and I didn't know the finance, but
Yeah.
one of my dad works at an academic medical center. My mom has
Okay.
her own private practice, and I just see my mom working a lot less and making a lot more, and I'm curious why. And she only do like probably 30 to 40
Your mom works in private practice.
private practice. Like she
Okay.
just does surgery a lot of times, and my dad does like stents and
Yeah.
longer things. So I was like, it's obviously more complicated and more life threatening. Like how does why does that make sense? And it turns out that there's just, as they tell me, there's just a lot of bloat or flaw in the system that
Yeah.
didn't incentivize doctors to maximize for the bottom line and the patient quality. It's really hard to do both. Quality and finance are often on opposite sides. And then private practice is just easier because you can literally say, okay, the optimum surgery for me is 40 or something number a month. I will do that like twice a week. You can optimize your schedule, right? And you have full
100%.
control. Yeah. So I was like, okay, at Google, I work on a lot of different sites with payers, with
Mm-hmm.
providers, and I see like there is incentive on both sides to change. Like payer actually do want to work with providers to make the process less painful because they do have a lot of people like reviewing and sometimes denying claims. Like it's not fun for them either. What they want to know is what's the fraud, what's the abuse and
What's
waste,
fraud
and how
and
to
what's,
prevent it.
yeah.
Yeah. Provider often see them as enemy. They'll be like, you're just giving us an excuse, but not really. So I think building trust on both sides is something that I wish can be done. And that's also the initial like inspiration of Ember, right? We started with we started with provider. We now have worked with payers too.
Mm-hmm.
The future, I think, will be a lot different than before. So in the past, people say there's like 10 billion or more fraud in healthcare. It was really hard to spot because it was
Mm-hmm.
all done in paper. It was the all like human. But future, if an AI can go over and figure out all the gaps that has existed in the system, the fraud will be pretty easy to find. And now, who is on the defense and who can do it right? That's where technology can really help. We're already seeing Medicare adopting the change next year, and then we're seeing different payers using different smart technology utilization management. So they're moving fast, and health system need a solution as well.
Yeah, I think you brought up an important point, and I'm also on the other side of the table where like I always like accuse in a wrong way, maybe. I'm not sure. I haven't been on the insurance side, but like always physicians accuse healthcare insurance companies, oh, like you guys don't want to pay. But you brought an important point because like they are also being reviewed by the patients when they are when they are denying claims. This is going to affect the number of people who are enrolled in their plans. So it's going to affect negatively for them. And I think the better way of looking at it, okay, so how we can detect the fraud better. Maybe they are not denying the claims, they are trying to minimize the fraud. And unfortunately, denying legible claims sometimes can be collateral damage. Unfortunately, it sucks to say, but and I see, yes, probably AI is the best way of solving this.
Yeah, and
Um,
just to give you some stats, right?
yeah.
Around 51% of the claims that were initially denied were ultimately accepted. So
Hmm.
whatever mistake
Sorry,
there
what,
was,
what percentage was that?
51%.
51%. Oh,
So
wow.
you can say half if you appeal enough 3 times and make
Yeah.
it overturned. The other stats I can share is the payer. They spend at least 20 minutes on the case, usually 20 minutes on average.
Hmm.
It may be simple for a primary care visit, but if this is a 20, 30-page surgery oncology report. How do you see all the results in 20 minutes and make a decision? It's super hard, let
Yeah,
alone their
yeah.
clinician or their people may not be credentialized. They may not be an expert in this specialty, right? So you eventually result to peer-to-peer. And the biggest complaint we hear from peer-to-peer process is the doctor don't think they're talking to someone who understands the nuance process, and
Mhm.
they just never reach in a conclusion. It varies from payer to payer. We also have talked to payers who will say if the medical director think it is a reasonable treatment, even though it wasn't documented, they will still approve it. So there's payers who are more on the lenient side too. But I think just like understanding the process and what's driving the motivation is really important.
Yeah, I completely agree with you. I want to shift gears a bit and talk about your experience in building the company. And I know that you and Ember went through a YC. Can you talk to me through your experience, especially like lots of people when think about like YC, they think about like Airbnb, for example. They don't think about like health tech companies, but there are so many health tech companies go through YC. And can you tell me like how YC helps? How do they shape your vision, your product, and talk me through your experience?
I think the magic of YC is they're truly agnostic
Hmm.
to the type of business. What they were interested in is building something for the future, like founders, companies who have real ambition that can change the world, right? And this happened not just in healthcare, but in pharma, in manufacture, basically any verticals that you have seen. When I was there, I mean, the community is pretty much alive afterwards. So I'm still pretty involved to talk to alumni, and I'll go back and share with current batches, which is the current founders in the latest YC batch. I think the magic is they put a group of really ambitious peers together over 12 weeks or however long the batch is now.
Hmm.
You have really aggressive goals to hit every 2 weeks. So I think a lot of this is my third startup. And the biggest difference with YC and without is the rigor, the focus on goals and doing the thing that actually matters. Because there can be a lot of vanity metric, right? Oh, hosting events or showing up and speaking. But if you're not figuring out the product
How
market
to
fit,
sell.
yeah, the actual sell, go to market, it doesn't matter because it will go away eventually in 2 years. So how to build a lasting company with influence, especially the market is changing so fast now. I think that's what YC knows for us.
Yeah, I think you brought up very important points. And I saw one of the people I follow on LinkedIn posted about like you see lots of people who are posting about like raising money or maybe raising money is considered a milestone to hit, but like hosting an event or speaking somewhere, and that really doesn't translate to increasing number of customers or having income, revenue. Like those are the two important things to a startup to survive. But yeah, those are important points, and thank you for bringing that up. Did they help to shape or change the way you were approaching things, or did they help you to go faster?
Both. I think the biggest change is focus.
Can you expand on that point?
So as an early stage startup, you actually can move really fast, probably fastest than any other competitors out there. The mistakes most people make is they try to do too many things, sell to too many different people, too many, I mean, even hospitals, like big hospital, small hospital, rural hospital, like city center modern hospitals, like they try to do everything all at once because they don't
Hmm.
really know what to focus on. That's probably the biggest mistake anyone can make because if you just focus on one hypothesis, a very specific one, and spend 2 weeks testing it out, you can learn a lot more. Instead, many people choose to just like, oh, I didn't see traction here. Let me try this and try that. And then they want to report, I mean, back to vanity metric, right? I tried this many things, but what's the result? What did you learn? Like, what is a secret that only someone who hustle in that industry or in that specific ICP or selling to that specific people can realize, right? YC really made sure we did that. So every 2 weeks when we meet with our group partners and our small group founders, we had to report on what we learned. And if we didn't, they will not let you make excuses. They will say, "So what's going on? Like what distracted you to
Yeah,
get to that meaty thing?"
gotcha. Okay. I want to shift gears again. I want to go back to the early days. So you were working at Google Health and you had like contact with the payer and the user and the provider. You came up with the idea. If I'm a person of, let's say I'm an entrepreneur listening to this, How did you build a team? How did you put people together and convince them that this is really a problem worth solving?
It took me 3 years to bring the initial team together. It's not easy because I think to me, people is the most important thing.
Hmm.
And this idea like has existed, you can say solving revenue in health hospital has been dreamed up since 1990s, maybe with different solutions with human,
Yeah.
but it's not a new problem, right? I think what differentiated the winner in the space is actually a team that can execute, deliver, and that likes working with each other. Most startups died by suicide. We see that,
That's a good way
and
of putting
yeah,
it.
we've
Yeah.
seen that in competitors already. And I just want to really make sure the best technical talent, which is someone I met around 8 years ago at Google, like can join, right? Like it takes a lot of just getting to know them, making sure it's the right timing. Like it takes forever sometimes to build the right team, but I think that's really what Google enabled me to have a platform and see what excellence look like. I remember like when we were building clinical software or like patient facing software, we can talk to any clinician. Like they have so many experts on roster. We can just put times on a calendar, validate something right away. And
Oh,
that was the
wow.
caliber we were used to. And those are probably some like chair of surgery at X famous hospital that is like contracting with Google, right? So it's really easy to reach world class talent and get results immediately. So that was the kind of network I wanted to have because validation is so important. If I spend a couple months building the wrong thing in a cave, the market has changed and left me behind. I don't want to be like.
Yeah, completely agree. Looking forward, let's say 2 years from now, where do you see Ember is going to be?
So our main goal is to flip the dynamic of revenue integrity. Right
Hmm.
now, it's 5% of human cost, just looking at claims, working through it on the hospital side. There's X how many billions being wasted every year. I
Hmm.
think that problem will be solved by many different players focusing on different segments. We would like to be part of the solution. And also, more importantly, like level the playing field. Health system has long been at a disadvantage because of just security and how things move, right? It's not the fastest organization. But I don't think that will limit what they can do because there's innovative research coming out. They obviously have a lot of great talents. How to work and enable those talents to put and support them, that's our goal.
Gotcha. Gotcha. My last question. Let's say I'm an entrepreneur listening to this. What advice do you have for the person who wants to innovate in healthcare?
It depends on which lane they choose.
Hmm.
Chronic care management, something with AI, therapeutics, whatever. But I would say they probably choose healthcare for a reason, whether it's a personal reason, professional reason,
Hmm.
they've done this before, but really hone in on that secret sauce
Hmm.
because there's enough problem to solve. We need more talents and more entrepreneurs in healthcare. And I would much rather see someone like bring their experience and knowledge to be an expert in the space and deliver something like that actually can tilt the wave that can change the market in a better way than building yet another clone or yet another thing that does not really have that. Because if they do that, they may see traction, but after a year or two, they will lose that momentum. And then it's not fun to work on something that doesn't drive you every day.
Yeah, I completely agree with you. I think one of the most common things I hear from people who wanted to come to health, and like even people who quit their jobs and they want to build something in health, is like they want to do something purposeful, beyond just building something. They want to build something that they wake up in the morning and feel like, oh, I really want to work on this today.
Yeah, I think that's the power of like, healthcare, climate, like industries where you can pretty much do good and make money, right? So that's awesome. And it's pretty great to hire people who likes to join the cause as well.
Yeah, I agree. Charlene, that brings us to the end. Thank you so much for being here today. I really appreciate your time, and I'm very excited about the future. And I will hopefully we'll follow up with you in a year or so on another episode.
Sounds good. Looking forward to it.